the purpose of an elimination diet is to eliminate foods that could potentially be inflammatory. Now, this first one, I would say in most cases is a good idea to completely take a break from. That's grains. Now, especially corn, because the research does show that corn can have a similar response as gluten. They can be harsh on the gut. Gluten is one of the things that can cause a leaky gut and can set the stage for an autoimmune thyroid condition. So alcohol should be completely avoided while healing. And a lot of people, when they think of alcohol, they think about the stress that alcohol puts on the liver, which is true. Alcohol does put stress on the liver, but it also puts stress on the gut. It can increase permeability of the gut, cause a leaky gut. So I am going to discuss 7 gut healing roadblocks that can prevent you from restoring your thyroid health. And also keep in mind that some of the other roadblocks that I'll be discussing will cause low stomach acid, which I'll also discuss here in this roadblock. But low stomach acid is common and of course is important for digestion, helping to break down nutrients, especially minerals. Digestion also helps to keep harmful gut pathogens in check. Like I said, it's all risk versus benefits, but without question, the research does show that they can affect the gut. And so the first gut healing roadblock I like to discuss is eating gluten. So many people listening to this understand that they should be avoiding gluten while healing. And one of the big reasons, because gluten is harsh on the gut. And research from, I believe it's 2015, shows that gluten can cause a leaky gut in everyone. And so that alone is a reason to avoid gluten, because there's what's called the triad of autoimmunity for those with Graves and Hashimoto's, as well as other autoimmune conditions. So according to the triad of autoimmunity, which I've discussed in different podcasts, there's 3 components necessary for autoimmunity to develop. There's a genetic predisposition, which we can't do anything about, but then there's exposure to one or more environmental triggers, which we can find and remove. And then there's that increase in intestinal permeability, that leaky gut. So eating gluten, as well as other factors that we'll discuss here. But gluten is one of the things that can cause a leaky gut and can set the stage for an autoimmune thyroid condition. And even if you don't have an autoimmune thyroid condition, if you have a non-autoimmune thyroid condition, it could still cause a leaky gut, which is not a good thing. So gluten, at least while healing, should be avoided. There's an argument that we should all avoid it permanently. If someone is dealing with celiac disease, of course, then you definitely want to be strict about avoiding gluten, even trying to avoid cross-contamination. If someone has a non-celiac gluten sensitivity, you also probably should be strict when avoiding it. But even if you don't have celiac disease or non-celiac gluten sensitivity, it's still a good idea to avoid gluten, at the very least, again, while healing. And then when you have restored your health, then you could decide whether or not you're going to reintroduce gluten, even if it's on an occasional basis. Some people definitely choose not to reintroduce gluten on an occasional basis. But again, let's focus on healing first. And then sticking to the topic of gluten before we move to the next gut healing roadblock is that some people wonder, is the problem really with glyphosate and not gluten? And the reason they bring this up is because they might have traveled to Europe or have a family member or friend who traveled to Europe, and that person was able to eat wheat in Europe. Let's say they went to Italy, they had the pasta, they had the pizza that was not gluten-free, and they did fine. And I had Dr. Tom O'Brien on the podcast, and I asked him this question, and his response was that the reason why people do okay, or some people do okay when they go to Europe, is because in Europe, these foods, the wheat, it's lower in FODMAPs. He was talking about it's a problem with FODMAPs, which again, I discussed this in other podcasts as well for those who are not familiar with FODMAPs. But he was saying that even when you go to Italy or other countries, I mean, gluten is gluten. It's going to cause an immune response. It can potentially cause a leaky gut. So yeah, glyphosate is definitely an issue, and I'll mention glyphosate a little bit later during another gut healing roadblock. But yeah, just regardless of where you are, whether you're in the United States, whether you're in Europe, whether you're somewhere else, you really want to, especially again, once while healing, you definitely want to avoid gluten. Let's move on to gut healing roadblock number 2, other foods that can be harsh on the gut. So, in addition to gluten, there are other foods that you want to, at the very least, take a break from while healing, or at least initially while healing. Some of the foods I'm mentioning here, you might not need to completely avoid while healing. Now, this first one, I would say in most cases is a good idea to completely take a break from until you have restored your health. And that's grains. Now, especially corn, but I would say other grains as well. And I pick on corn a little bit just because the research does show that corn can have a similar response as gluten. But there's a reason why grains are excluded from not only an autoimmune paleo diet, but a regular paleo diet. And again, they can be harsh on the gut. I mean, I enjoy eating grains every now and then. Again, keep in mind, I'm in a state of wellness right now. So I did avoid grains while I was healing when I dealt with Graves' disease back in 2008, 2009. But every now and then I'll have some gluten-free grains. And I understand that it can make it easier I mean, it's difficult to follow restrictive diets, even though there is a lot of variety when it comes to fruits and vegetables, for example. But some people are used to eating rice on a regular basis or oatmeal on a regular basis. But I would say take a break from grains. And there's a really good book called No Grain, No Pain from Dr. Peter Osborne. So if you want to learn more about the concerns with grains, you might want to check out that book. Nightshades. So this includes tomatoes, eggplant, peppers, as well as white potatoes. So nightshades also have compounds, including alkaloids and glycoalkaloids that could be harsh on the gut, cause inflammation. Again, not everybody, but the purpose of an elimination diet is to eliminate foods that could potentially be inflammatory, that people commonly react to. And nightshades, again, we're not eliminating these because they're sensitivities. And I bring this up because I've had over the years people who have done food sensitivity testing, and they'll show me the panel and they say, hey, look, tomatoes are fine for me to eat, or eggplant's fine for me to eat. And again, we're not excluding nightshades while healing because of sensitivities, but again, they could be harsher on the gut, similar with grains. So if you do a food sensitivity test and it shows that you're not sensitive to certain grains, especially the gluten-free grains, you might think, hey, why not have some of these grains? But again, that's not why we're excluding some of the foods that I'm mentioning here. That also includes nuts and seeds. So nuts and seeds are paleo-friendly, but they're not AIP-friendly. And when I dealt with Graves' disease back in 2008, that's when I was diagnosed, and there was no AIP diet back then. And there were gut healing diets, but I just followed a paleo diet initially, and I hit a road in my recovery. And I wasn't a real big egg eater at the time. So I cut out the nuts and seeds, and then I saw improvement in my progress. So that seemed to be a roadblock in my case. And again, I didn't exclude them for too long. It was maybe about 3 months that I cut out the nuts and seeds. And again, nuts and seeds, that just like nightshades, there's health benefits, good health benefits of nuts and seeds, good source of monounsaturated fats. But again, they can be harsh on the gut. And so another reason to consider avoiding them. Now, there are some people I work with, even those with Graves and Hashimoto's, who choose to continue eating nuts and seeds. Like they might follow a paleo diet rather than an AIP diet. And some of these people do okay. Some of these people don't do okay. Like some of these people like me, they'll hit a roadblock. So that's why I encourage people to follow AIP initially. But if someone is absolutely opposed to following AIP, but they're willing to follow a paleo diet, then again, let's see how you progress following a paleo diet. I do want to mention dairy, because I haven't come across research that shows that dairy specifically causes a leaky gut. Dairy can be inflammatory in some people. It's a common allergen. And I mean, if you're going to eat dairy, you definitely want to eat healthier forms of dairy, like drinking A2 milk or raw dairy and not the pasteurized, homogenized dairy. But even so, I would say while healing, it's a good idea to take a break from dairy, mainly because it's a common allergen, not necessarily because it will cause a leaky gut. And maybe it does, but like I said, the research is more clear with gluten as well as corn. And then also want to bring up legumes, because legumes, like nightshades, or should I say like grains, legumes are excluded from both a paleo as well as an AIP diet. But legumes, they do have some really good health benefits. And if someone's a vegan, for example, they might not be able to get protein from other sources. And so in my book, The Hyperthyroid Healing Diet, I talk about different types of diet. And one is a level 1 diet, which is a modified plant paradox diet. The plant paradox diet is from Dr. Stephen Gundry. And so if someone's a vegan, just because otherwise they probably won't get enough protein, I do think it's okay for them to have some pressure cooked legumes, for example. Legumes, lentils, they do have some good health benefits, but they could also be a little bit harsh on the gut. Now, again, pressure cooking them properly will minimize that. So this is one that's more debatable, but I would say if you want to play it safe, avoid legumes while healing. But if you absolutely want to have them, especially if you're a vegan vegetarian, then you might be okay eating legumes. Let's move on to gut healing roadblock number 3, which is drinking alcohol. So alcohol should be completely avoided while healing, and then even after healing, want to minimize it. And a lot of people, when they think of alcohol, they think about the stress that alcohol puts on the liver, which is true. Alcohol does put stress on the liver, but it also puts stress on the gut. It can increase permeability of the gut, cause a leaky gut. Now, are there exceptions? For example, red wine, white wine definitely has some good benefits. And there is a little bit of controversy in the research. Some studies show that red wine can cause a leaky gut. Some show that the polyphenols can benefit the gut microbiome. So, I think red wine, without question, as well as white wine, I think they do have some good health benefits. Like, it's not all bad, but still the alcohol can increase permeability. And so I would say try to take a break. If you're a wine drinker, for example, still I would take a break from the wine, and same thing with other types of alcohol. Some people might like beer and then ask, well, can I drink gluten-free beer? But again, it's not just the gluten we're talking about, it's the alcohol that can affect the gut. And then another question I sometimes get asked is, how about alcohol from herbal extracts, like liquid herbal extracts that have alcohol? So with herbal extracts, these usually have such a small amount of alcohol. Even if it says like 50% alcohol, if someone's taking like a teaspoon, so they get like 2.5 milliliters of alcohol per serving, even if they're taking a few servings per day, it's usually not going to be enough to cause a leaky gut. And everything, of course, comes down to risk versus benefits. So you might think, well, how about an alcohol-free extract, something that uses glycerin instead of ethanol? And it's an option, but the reason why ethanol is used is because it's a really good solvent. It's a lot better than glycerin, does a better job of extracting the phytonutrients from the herb. So in other words, ethanol, if you use an alcohol-based tincture and alcohol-based extracts, you will get greater benefit from the herb that you're taking. On the other hand, if you're sensitive to alcohol, of course, then take something that has glycerin, like a non-alcoholic extract. But I wouldn't avoid an alcoholic extract because of the concern that it might affect the gut. Like when I dealt with Graves, I took bugleweed and motherwort. I took 2 different herbs and liquid herbs, and they had alcohol. They weren't alcohol free. And again, everything turned out fine. And over the years, a lot of my patients have taken liquid bugleweed, liquid motherwort, some people taking other liquid herbs. So again, very small amounts. It's different than having a cup of red wine or other alcoholic beverages. If you're looking to do everything you can to save your thyroid, in addition to watching my videos on YouTube, you also might want to subscribe to my free online newsletter, which is called Healthy Gut, Healthy Thyroid. Not only will you get the latest news on how to heal your gut and restore your thyroid health, but during each edition, I'll demonstrate a different blood or functional medicine test marker that relates to healing your gut and or your thyroid. There will also be an Ask Dr. Eric section where not only can you see questions that other people have asked related to gut and thyroid health, but you can also submit a question for me to answer in a future edition. To subscribe to the Healthy Gut, Healthy Thyroid newsletter, please visit savemythyroid.com/newsletter. Let's move on to gut healing roadblock number 4, which is low stomach acid. And also keep in mind that some of the other roadblocks that I'll be discussing will cause low stomach acid, which I'll also discuss here in this roadblock. But low stomach acid is common, and stomach acid, of course, is important for digestion, helping to break down nutrients, especially minerals, also important for protein digestion, also helps to keep harmful gut pathogens in check. So you want to have healthy levels of stomach acid, and there are other benefits as well. It helps to activate digestive enzymes. The problem is that the symptoms of low stomach acid and high stomach acid can be similar, and also not everybody with low stomach acid will have symptoms. So if someone has symptoms such as heartburn or reflux, most medical doctors will associate this with too much stomach acid, and as a result, they'll recommend an acid blocking medication, so a proton pump inhibitor. And if someone takes that on a short-term basis, not a big deal. I shouldn't say it's not a big deal, because even on a short-term basis, if you could avoid it, great. But it's definitely more of a concern when someone's taking it long-term. And a lot of people take these acid blocking medications for months and even years. And it's a problem because, I'm not saying there's not a time and place for taking it long-term, but some doctors will just give it to their patients, have them take it long-term, and never try to address the cause of the problem. And again, a lot of times it could be a low stomach acid problem, not too much stomach acid. That being said, you do need to be careful. It's not, it could be like too much stomach acid too. So like I like Betaine HCl, and it's something that's in my digestive enzymes plus, and it has a smaller amount than what's in a separate Betaine HCl supplement. So most people seem to tolerate it well. But if someone has too much stomach acid, then especially taking like a separate Betaine HCl supplement might be too much and might cause heartburn or other symptoms. And there is something called the Betaine HCl challenge, and that actually involves taking Betaine HCl to see how you respond. So if you take Betaine HCl, or if you take, again, a digestive enzyme that has Betaine HCl, even though it's a smaller amount, if you take it and you feel heartburn, for example, that might mean that you have enough stomach acid, or in some cases too much stomach acid, and then you should back off. So with the Betaine HCl challenge, if you take a separate capsule of Betaine HCl and you do fine, then and you always want to do this with meals high in protein, at least 10 to 15 grams of protein. Never do this on an empty stomach. But if you're fine taking a single capsule, then according to the Betaine HCl, you'd want to take a second capsule. And let's say you do fine with the second capsule, but then you add a third capsule and you get some heartburn. That's telling you that that's too much, and you want to back down to the 2 capsules and take the 2 capsules of Betaine HCl per meal while trying to figure out what the cause of the stomach acid, the low stomach acid problem is, so you don't have to rely on Betaine HCl on a long-term basis. There are other things you can do, such as bitter herbs that you could take, but ultimately you want to try to address the cause of the low stomach acid. And one potential cause is an underactive thyroid, so low thyroid could be a factor. Now, this doesn't mean if you have hyperthyroidism, Graves' disease, you can't have low stomach acid, because chronic stress could also cause low stomach acid. And a lot of people deal with chronic stress, including myself when I dealt with Graves' disease. H. pylori also can cause low stomach acid, and H. pylori, very common in those with especially autoimmune thyroid conditions such as Graves and Hashimoto's. All right, let's discuss gut healing roadblock number 5. So speaking of chronic stress, that's what gut healing roadblock number 5 is: chronic stress, as well as imbalances in the parasympathetic nervous system. So these two are related. So chronic stress decreases secretory IgA, and secretory IgA lines the mucosal surfaces of the body, including the gastrointestinal tract. It's not a leaky gut marker, but if you have low secretory IgA, it usually relates to leaky gut. Like in most people, when I used to do a lot of leaky gut testing, and I noticed that just about everybody who had a low secretory IgA also tested positive for leaky gut. And secretory IgA, it serves as protection. And so you definitely want to have healthy secretory IgA levels. A lot of people deal with chronic stress, so a lot of people do have lower or depressed secretory IgA. Also, chronic stress causes imbalances in the parasympathetic nervous system, which is the rest and digest system. And so having imbalances in the parasympathetic nervous system can lead to digestive issues, also can cause mood disorders, so like depression, anxiety. And so what can you do? Because no matter how good you are at managing stress, it's always going to be a factor. But the problem is most people don't do anything to manage stress. So yeah, it's even if you block out time to manage stress, it still might be a factor, but blocking out time for stress management still could be greatly beneficial. And I recommend blocking out 5 minutes per day. Start with 5 minutes per day, even just doing some simple deep breathing. Again, walking, exercising. Walking is relaxing. And I'm not saying it's not a form of stress management, but you want things to really activate your parasympathetic nervous system. And I mean, definitely like exercise, if you're doing cardiac exercise, like cardio exercise or resistance exercise, that's more of a sympathetic activity. And so some quiet time, mind-body medicine, again, just doing some deep breathing 5 minutes per day can help. Now, of course, longer than this is better, but the goal is to get into the routine of stress handling. So of blocking out time for stress management. So if you're in the routine of blocking out 5 minutes per day, 7 days a week, then you could start increasing the duration. Another thing you could do is incorporate vagus nerve exercises. Again, mind-body medicine is stimulating the vagus nerve. So that's a vagus nerve exercise. Vigorous gargling is another vagus nerve exercise. Singing out loud, either in the shower or in your car, or it doesn't matter where it is, but that also stimulates the vagus nerve. Cold showers, I mean, cold plunges too. I can't say I don't do cold plunge. I was gonna say I'm not a big fan of cold plunges, just personally, like it's something I don't do, but I do cold showers, rotate hot and cold showers. But if you're willing to do cold plunges, that also could activate the vagus nerve. And yeah, so vagus nerve exercises can make a big difference as well. Gut healing roadblock number 6, gut infections as well as overgrowths. So I mentioned H. pylori. That's something I commonly see, and it, again, could definitely affect the gut. I mentioned how it could be a factor when it comes to low stomach acid, potentially increased permeability of the gut. We have parasites that also can affect gut permeability. And there are other infections. I'm not going to name all of them here. They're like Yersinia enterocolitica is another one. Giardia. I mean, there's, again, which is a parasite. So there's, again, a lot of infections that could affect permeability of the gut. Not all of them will. So like if you do a comprehensive stool panel and you see some dysbiosis, which is imbalance of the gut flora, it doesn't always mean that you're going to have like a leaky gut, for example. So it really depends on which microbes are out of balance and how many microbes are out of balance. Candida. So Candida is not an infection, but you could have too much Candida, so Candida overgrowth, and that could affect permeability of the gut, so that can cause a leaky gut. And then there's also SIBO, small intestinal bacterial overgrowth. So too much bacteria in the small intestine can also lead to an increase in intestinal permeability, can lead to that leaky gut. So yeah, I mean, the gut infections, gut overgrowths, reasons why some people, they don't heal. And I mean, testing is in most cases the best way. It's not perfect. Like for parasites, you could do testing and have false negative results. I mean, with all these, testing isn't perfect, but I do like testing. I know there are practitioners out there, even practitioners who have been on the podcast, who don't like testing, who just like treating everybody for parasites and treating for other things without testing. And I realize it's a catch-22 because it's not perfect, the testing, and the testing's not free. It could get expensive when you do functional medicine testing. But if at all possible, I'd like to identify what's actually causing a leaky gut when it comes to like gut infections or overgrowths. And if we're suspecting a parasite and we do testing and it comes back negative, then at that point, I'm okay with treating the parasite. But I usually like to confirm it, but admittedly, it can be challenging. And again, obviously different perspectives out there. All right, so the 7th and final gut healing roadblock I like to discuss, environmental toxins and toxicants. So certain environmental toxins and toxicants can disrupt the gut and or prevent it from healing. So I mentioned glyphosate earlier. So glyphosate is the active ingredient in the herbicide Roundup. So that can cause dysbiosis, imbalance in the gut flora, which in turn could cause that increase in intestinal permeability. Xenoestrogens, including microplastics. So there's been a lot of talk about microplastics, and they act as endocrine disrupting chemicals, so they could directly affect the thyroid, but they also have been shown to affect permeability of the gut. So, and I didn't know this until recently. I've done a lot of research over the years when it comes to xenoestrogens, but didn't realize the impact they can have on the gut barrier. And so another reason you want to minimize your exposure to plastics. Mycotoxins from mold can potentially affect the intestinal barrier. Certain heavy metals, including mercury, can also affect the intestinal barrier. It could affect the thyroid directly, it could affect the immune system in different ways, but also can affect the gut. And then, of course, medications. So medications, antibiotics, we all know that can cause a leaky gut. I mentioned PPIs, proton pump inhibitors, acid blocking medications. These also can cause a leaky gut. Plus, they block the acid, which breaks down nutrients. So you don't have that ability, or you have an impaired ability. And then I mentioned stomach acid is important for keeping bacteria and other pathogens in check. So if you're taking acid blockers, it'll make you more susceptible to gut infections and overgrowths, which is another gut healing roadblock that I mentioned. And then for those with hyperthyroidism, anti-thyroid medication also can disrupt the gut. Again, risk versus benefits. So this doesn't mean that you should not take anti-thyroid medication and never take antibiotics. There's a time and place for these. Everything's risk versus benefits. I've worked with a lot of people over the years who have taken anti-thyroid medication such as methimazole, PTU, and were able to restore their health. Now, might it take a little bit longer if you're taking a medication? Maybe. Everybody's different. It depends on how high of a dose of medication you're taking. But like I said, it's all risk versus benefits. But without question, the research does show that they can affect the gut. So these are the 7 gut healing roadblocks that can prevent your thyroid from healing. As usual, I hope you found the information to be valuable. And of course, I look forward to catching you in the next episode.